Jim, thank you so much. It is now 6 minutes after 6 o'clock, and according to the World Health Organization, nearly 3,000 people on average commit suicide daily, and even more try but are unsuccessful. A push is now underway to get those numbers down. Andrea Mock is in our phone bank with some representatives, some professionals from the American Foundation for Suicide Prevention, who will be taking your calls throughout the evening. Ann.
You know what, Darcy, it's a subject that's very hard to talk about, but very important to talk about too. We've seen in the news and done the stories in the last several months about troops coming home from deployments overseas and the number of suicides going up. And in a military community with McEntire, Shaw Air Force Base, and Fort Jackson right here, we have troops deploying and coming home all the time. It's important to get them help to readjust, as well as their families too, and the wives and the children and the husbands who have a hard time readjusting as well. So one person that we have standing by taking your calls today is Amy from the Veterans Hospital. And you know, it's not just the troops, but the entire families that can really struggle readjusting when the husband or wives come home.
Absolutely, and we really encourage the veterans to get into the VA to get health care, and we're really opening up to have families coming in and being part of that care as well. It's such a critical part of care because the family members are really struggling with them at times too. So we really want to get them in and into mental health services as well as getting the medical care that they need.
You know, it's something that unfortunately is taboo in our entire society, but especially in the military community. How best can we reach out to them and tell them to call you guys and get the help that they need tonight?
They definitely can call the Veterans Crisis Line, which is a national, it's part of the National Suicide Hotline, but what it is it's 1-800-273-8255, and that's a national call line that anyone can call into, a veteran or their family members, and that can connect them to the local VAs as well. They can also call us locally at the VA and reach out, and when you call in, you can call and ask for the suicide prevention coordinators, and we can help get that service set up.
And last question really quickly, if people don't have the money and they think they don't have the money for counseling, is there any help out there to help pay for it for the families?
Absolutely. Veterans who served in the military, many of them are eligible for services, and many of them are eligible for free services through the VA. And there's also a lot of community resources as well that are available.
Amy, thank you so much for donating your time to be with us today. We really want all of you that need help to reach out and call. It's free advice, 647-0299. We're taking your calls until 7:30 tonight. Guys, back to you.
Thank you, Andrea. Free advice and definitely not anything you need to be ashamed to ask for.